Here's a number that should stop you cold. Women wait an average of 4 years longer than men to receive a correct diagnosis. For the same symptoms, 4 years of being told labs are normal, 4 years of being told you're fine. Today, I want to explain exactly why this happens and what actually changes it. I hear this every single week from women in my practice. My doctor ran labs and said everything was normal. They told me I was just tired. I should get more sleep. I was told it was just anxiety. They gave me a prescription. I was told this is just what happens as you get older. And here's the thing. These women weren't being dramatic. They were not overreacting. They were describing real, measurable changes happening in their bodies that the standard of care simply wasn't equipped to find. If any of this sounds familiar, I want you to hear something clearly. You are not imagining your symptoms, and you're not alone. I'm Dr. Myra Reed. I practice early detection longevity medicine, which means I help people, especially women, identify what's going wrong in their bodies years before conventional medicine would catch it. In this video, I'm going to cover 3 things. Why the current medical system is structurally failing women, what the research actually tells us about the gaps in women's care, and how functional medicine approaches this completely differently. What is optimal, not just normal lab levels, and actually look at evaluating whether hormone replacement would be advantageous for your overall health and wellness. Because we know that normal and thriving are not the same thing. Here's something most patients don't know. For the most of the 20th century, women were largely excluded from clinical research trials, thinking that women hormonal cycles would complicate the data. So the solution was to just not include women. That means that the medical knowledge base that we still use today into dosing guidelines, the diagnostic criteria, and the lab reference ranges that were almost entirely on male physiology. The classic heart rate symptoms taught in medical school based on male presentations. The symptoms more common in women like jaw pain, nausea, fatigue, upper back pain were treated as atypical, unusual, even suspicious. Autoimmune diseases affect women nearly 3 times more than men, but the average time to diagnose these conditions like lupus, Hashimoto's, or rheumatoid arthritis for a few can stretch to 5 years or more before the women are often diagnosed. They're told that their symptoms just don't fit a pattern. This is not coincidence. It's a structural problem built into the system from the beginning. And then there's this normal lab issue, which I see happening in so many standard labs. Most standard lab reference ranges are calculated from population's averages. They're designed to catch people who are significantly outside the middle, meaning someone with advanced diagnosed diseases. They're not designed to catch early dysfunction. Here's a specific example. TSH, the thyroid stimulating hormone. TSH is one of the most commonly ordered tests. The standard reference range at normal labs is 0.5 to 4.5. So if your results come back at 3.8, your doctor may say that it's normal. But emerging research and the clinical experience of many functional medicine practitioners, including my own practice, suggests that thyroid-related symptoms often appear well before the upper limit is reached. Many functional medicine practitioners aim for a TSH closer to 1 to 2 for this optimal function. The normal lab is telling your doctor that you're in bounds, but your body is telling you something's wrong. And in that gap between technically normal and actually thriving is exactly where functional medicine works. I want you to pause here and ask you something. Have you ever felt like you left the doctor's appointment feeling like your symptoms were minimalized or explained away? Drop a yes in the comment below. I read every one of those comments. And I think you might be surprised how many women are nodding along right now. And if you're finding this helpful, please subscribe. I post every week on women's health, longevity, and early detection. And I don't want you to miss what's coming later in this month. 5 ways functional care changes everything. So what does functional medicine actually do differently? I want to be real specific here because this isn't just about running more tests. It's about a fundamentally different lens. Functional care starts from a different question. Instead of asking, what diagnosis does this fit? It asks, why is this happening? That sounds like a small shift in language, but it's a massive shift in what your care actually looks like. Number 1, it treats your symptoms as data, not complaints. When you tell me that you're exhausted every afternoon, I'm not writing down fatigue as normal aging. I'm asking, is it blood sugar, cortisol, thyroid, iron, sleep architect? Each of these has a completely different solution. Number 2, it runs deeper labs. Standard panels are designed to catch disease. Functional panels are designed to catch dysfunction. The early warning signals that appear months or years before disease develops. Things like fasting insulin, homocysteine, comprehensive inflammatory markers, advanced lab thyroid panels, and micronutrient levels, among other things. And number 3, it maps connections across body systems. Hormones don't operate in isolation. Your gut health affects your estrogen levels. Your sleep affects your cortisol. Your stress affects your thyroid function. Functional medicine traces those connections rather than treating each symptom in a silo. And number 4, it accounts for your life stages. Women's physiology is dynamic. It shifts through the menstrual cycles, across the reproductive years, through perimenopause and menopause. A functional approach recognizes how these transitions affect every system in your body and adjusts care accordingly. And number 5, it puts you in the room as an expert on your own body, your lived experiences, how you feel day to day, what's changed, what feels off. And this is treated as valuable clinical data. Those 5 things together represent a completely different model of care. I want to take a moment to talk to you about what's actually at stake here. Every disease has a window, a period of time where early intervention is not just possible, is genuinely powerful. Heart disease, autoimmune conditions, metabolic disorders, cognitive decline, and certain cancers. The earlier we catch what's happening, the more options we have, the better the outcomes, and the more life you get to live fully. The tragedy of women being dismissed in medicine isn't just that they feel unheard at that moment. It's that during the years of wait and see, that window is closing. You deserve care that keeps this window open. I want to tell you what I hear most often after a woman's first functional medicine appointment. Not, I finally got a diagnosis, not just that I finally know what's wrong with me. The most common thing I hear is this. This is the first time I felt heard or believed. The moment matters more than any lab result because when you feel heard or believed, something shifts. You stop minimizing your symptoms. You stop second guessing yourself. You stop waiting for things to get bad enough to just justify asking for help. You start getting the care you actually deserve. That's where healing begins. Not with just a diagnosis, not with a prescription, with being believed and validated. Okay, if you're watching this and you've been thinking, where do I start? I have something for you. I created a free resource called the Women's Hormone Quiz, and this informational guide covers key hormones, optimal ranges, and when to consider getting tested or seen by a functional medicine doctor. I've included the functional optimal ranges, not just the standard normal cutoffs, and questions you might want to bring directly to your next doctor's appointment to start that conversation. The link is in the description below. It's free. Download it, print it out, and bring it with you. And if you're not already subscribed, Please subscribe and hit the bell. I post every week, and May is Women's Health Month. I have an entire month of content planned around this topic that I genuinely believe is going to be valuable for you. Next week, I'm going to walk you through the specific labs that every woman in her 30s, 40s, 50s should be asking for, including one biomarker that almost no one tests for, but that is one of the strongest predictors of cardiovascular risk in women. You don't want to miss that one. I'm Dr. Myra Reed, and I'll see you next week. I want everyone to live smarter, stronger, longer.